Hi everyone, I bring greetings from Agra, the city of love. So today I've been given this wonderful topic by the organizers, challenges of practice in young women doctors. I especially thank Dr. Mandakini Meg ma'am for considering me for this topic. Well, let's first describe what is a challenge. When you open the dictionary, you see a challenge is a call to someone to participate in a competitive situation or fight to decide who is superior in terms of ability or strength, or a call to prove or justify something. When we think about women by some philosophers, from long time back, they say nature intended women to be our slaves and they are our property, was said by the famous Napoleon Bonaparte. Similarly, Aristotle does say that women need to be governed. The relation of male to female is by nature a relation of superior to inferior or ruler to ruled, was said by Plato. Society is the biggest reason behind problems faced by any young woman to move ahead. It has to be left behind. And that's why we all are here. We women have proved ourselves in every field. Today, women are a part of almost every profession possible in the world. In spite of this, why is this reality still present? We do face a lot of challenges in whatever we do, like denial of opportunities, lack of encouragement, lack of support, gender bias, pay differences, imbalance in the environment. A huge reality is women still make up as 80% of all refugees and displaced people. 603 million women live in countries where domestic violence is still not considered a crime. Even in India, when we talk about women, Tamil Nadu, Maharashtra, and West Bengal still have the highest proportion of female suicides. We still have women suffering from acid attacks in our country. When we talk about the world of education and profession, 40% of businesses or corporates have no women in senior management. Yes, there is something called as the glass ceiling. And this is one terminology which has been described for treatment of women at her workplace. And this glass ceiling indicates a symbolic barrier in our hierarchy. A very recent survey was conducted, which I went through while preparing for this talk, which said 60% of young female doctors have no personal satisfaction. 30% of these young doctors say they have very restricted opportunities to grow in their field. 51% of young women doctors believe that this glass ceiling still exists. 62% said yes, bias is still present in medical colleges, in corporate hospitals, and in government sector. 34% of young women doctors are overburdened. Where are we headed? Yes, there are women who have proved that this doesn't exist or they've proved the society wrong. But why do we as women have to prove anything? When we talk about any woman from any profession, 100% of women will say that some way or the other, they have been felt inferior to their male counterpart. As a young working mother, doctor, obstetrician, I say it has never been easy for women to juggle a thriving career and a happy family life. It still isn't easy, especially when you are also a mother. You will have those bouts of difficulties. Then being said, yes, we are in the 21st century where women from all walks of life are choosing to have it all, a blissful family, a rewarding career, and even some solitude. But why are we having to face these challenges? If I give you a brief list of the challenges a young doctor faces, well, that list will go on and on. A few of them is family versus career, making food versus going to that OT, self-care versus caring for your children, socializing with friends versus attending conferences, doing research or teaching your children. It doesn't end here. There are some more. Where is that quality me time? And if you're an obstetrician like me, we work 24/7, 365 days. If you are an institute, I'm sure that male versus female competitiveness is there. If you are in a corporate, that doubt of how to establish yourself is still there. And yes, that big, huge difference between the salary of a female young doctor and a male young doctor. There's always that difference. The bigger challenges in this society which we face, which actually need drastic change in the mindset, are this patriarchy and, of course, the gender bias. We say challenges faced by women doctors are presumed to be very different and complicated. Yes, they are, in a way, with managing our professional responsibilities with our personal front, managing those night duties with our children, managing your academics, administration. Yes, young women doctors face more strain to deal as both women plus doctors. A huge article was published in Medscape 2020, and some important concerns came into picture. When we talked to a lot of women, what were the concerns which the women actually face while working? First, topmost was the work-life balance. Second was compensation. Third was combining parenthood. Why is infertility on the rise, especially with the working class? Because that balance or that combining your work and parenthood is something which is very, very difficult, especially when you don't have that amount of support at your workplace and at your family. Career development, relationship with colleagues and staff, age discrimination, sexual harassment were some few more. Women doctors are stigmatized for taking their family time. Yes, they are. Only 50% of women take full maternity leave. Some others might take flexible or fewer hours to accommodate their family responsibilities, and they are usually laughed upon it. Female physicians and doctors have a higher burnout rate, especially below the age group of 45. So young female doctors are facing that burnout. In an article in 2016 in UK, it was published the pay scales for female and male doctors. And you can see a difference in the percentage ranging from 26% in 2006 to a larger 34% difference in the salaries of a same stature doctor. So to do two things at once is to do neither. But we women have to do a lot more than two things. Don't we? We have to balance that work, that home, and also the children if you have kids. When you ask me the challenges of a young woman doctor, I say being a strong female is a challenge itself, full stop, nothing else. Look at this picture and most of you will say, a 3-year-old female child in the house picks up the broom. What is our mentality? Most of the adults in the house will say, oh, you're behaving like a woman. That's so nice. But as soon as that boy picks up the broom and starts cleaning, the mentality changes. Don't we all do it? Patriarchy, a term which has been there since ages, but coming up in a big way now, is a social ideological concept which considers men superior to women. It considers males as a primary authoritative figure and central to social organizations, occupying roles in leadership, moral authority, and even on control of any property. So patriarchy is a term where men hold authority over women and children. And that's where the challenge has begun. Go back to the reflections of your childhood. Recall experiences in the childhood. What did you do as a child when you were a boy or a girl? Think of an activity which you dreamt of and wanted to do, and were you led to do. Things are so typical towards gender, and that gender bias came as soon as you were born. You know, the change in the activities of two genders begins at home, and that's where the challenge of being a female starts. The frustrations of being a female, then a working woman, begins from the day we are born to growing up, to going to school, to managing a profession, to managing a family. And that's where it is so important for each woman to be strong enough to understand these challenges and face them. When we talk about women traditionally, long time back, the role of women was only cooking, cleaning, raising children. They were looked after upon as a caregiver or a homekeeper. Some were even denied access outside home. And when we look at women now, most of us are women here. So many successful women are present and watching this webinar here today. We women have done it all, haven't we? Even as working young women, when we say about statistics, women will still do more housework regardless of who the breadwinner is, because we have been brought up in that way. So the important thing here we need to add is to teach both ways work-life balance, because work-life balance is something which has to be done for the complete family and also colleagues, staff. Because when we understand that phenomena, that each one needs that little special attention, things will definitely start changing. Difficulties in work-life balance as a young female doctor is managing that burnout which happens, time management, managing your marriage with family, and of course, retirement plans. Few small techniques which I would like to say to all young female doctors watching this is, it's important to have time-saving techniques in your practice. You should understand and prioritize your work, delegate your job, learn to say no, and analyze what is important. Yes, we have to manage parenting plus medicine together. We are at a stage where we understand that there is a right time for everything, and there's also a right time to have children. So the pressure of balancing family and work commitment becomes enormous on a female. That's where you have to develop good, strong bonds with your family and support system. Children, medicine has to go on together, and you really have to understand to enjoy it. Find a system that works for you, where you have to get a lot to require that extreme amount of organization. So plan a strategy around your workplace. Incorporate people in your workplace to understand and help you to get the best out of you. It's important for us young women to be better organized to manage our time. Update yourself electronically. It's so important. Yes, we have to sometimes multitask, and it is also important for us to be very, very proactive. Track your time to track your productivity. And as I say, important actionable items have to be done as soon as possible so that they don't pile up on us. Do things when you have time. So free up your time when you need it the most. Of course, choose a workplace where you are most productive. Mindset is changing, patriarchy will decrease, but it will take time. Any strong woman in every organization can actually bring that change. And we together will definitely work towards making women more comfortable. So we have to understand how to utilize our networks, stay very, very focused, and of course, to look after ourselves and plan very ahead. And so important to recharge your battery whenever you get that burnout. Don't keep adding on to that stress. So to face any challenge, a woman needs to be self-confident, should keep herself up to date with latest happenings in the world of technology. Internet has actually helped us in a lot of ways. Another most important thing as a young woman doctor is to maintain that balance in work and professional life and personal life. And also, we have to educate our men and tell them to respect other women like they respect women in their family. Know your laws properly, because there are a lot of laws which protect women in their workplace, which protect women in a lot of things, even in equal remuneration of pays, also in domestic violence, also in sexual harassment at workplace. So you have to understand and know your laws very, very well. And as a conclusion, I always say, love what you do. So if you enjoy being a doctor, focus on that sunny side up. We women actually are waiting for the right time to express our feelings freely and implement those ideas in a more liberal way to break that patriarchal society. Women doctors take problems as opportunists and treat them very optimistically, and we are actually considered more workaholic with more positive attitude in critical situations. It is said that yes, significant women doctors are dissatisfied due to less time with family, owing to a busy professional work, and they are overburdened with that night duties, the gender bias, and the lack of opportunities. But prior planning, time management, interval gap between working hours, willing to leave a place where not appreciated, and managing your duties with your colleagues will definitely help in influencing and harmonizing your professional and personal life. As senior doctors here, I feel we all should have a stress-free environment at workplace and support from colleagues and administration for a female working doctor. We women need stable, strong psychological behavior by adapting situations with directed skills, stress management techniques like yoga, meditation, skill development trainings, and even personality development trainings to compete with men in this patriarchal society. Work will cause you burnout, but we have to understand to balance that work with life. Evolve as a comprehensive human being with Physician Incorporated. Thank you.